Kristen. I have been ill since 1998, and I was fortunate enough to have a mother who found Dr. Klimas right away. And so this is before the Institute was created. So I've been there since the very beginning, and I have been helped a lot by everybody over the years, but it's been a very slow increment progress. I had started with alternative medicine fairly early on. Massage therapy was some of the stuff that I started with for pain. It was hard to find somebody who I could see regularly. The programs I was involved in were like, we have somebody available on this date, but it wasn't always the same person. So they could help me with specific problems, certain pains, but I couldn't get a comprehensive treatment. And there were people I came across who were very encouraging, felt they could really help, but in the end, they didn't really understand the chronic fatigue. Pain clinics and other places of that nature, they were very gung-ho, and they really wanted to get me off of pain medicines and such. But it didn't last. Nothing was really lasting until I really started seeing Dr. Junko and dealing with other people at the Institute, where they have an understanding of what's the nature of what's wrong, and that it's a slow progression of treatment, of getting better. It's incremental getting better, which has been the thing all along, even with the medicines. I did have a magic pill, but it did make me better. It just made me not dizzy, which to me was magic at the time. Everything else has been just a little treatment here, a little better there, and getting better over the years. And having a group that understands that's the way this goes, that we chip off at the little bits, and having a comprehensive treatment and a plan has been very useful. With Dr. Junko, she was able to help me get well enough to start doing some of the standard stuff that people always tell you to make your own food so that you can keep weight control, so you can eat healthier and stuff. Because before that, I'm like, yes, it's a lovely idea, but it takes energy to cook, and if you don't have energy to get out of bed and do very much, then cooking is not something that you have the energy to put into. And she was helped me to feel well enough to have the energy to start cooking some of my own meals. And then being able to do that helped me start to lose weight and do some other activities to help improve my health. And she's been good with keeping track of that with me, and with suggestions of things that I can change, and encouragement along the way, which is always a big.
That's wonderful. Thank you so much for sharing that. And it's so cool that you had that previous connection to the Institute. And I completely understand how coming to the Institute versus other places, you get that comprehensive look that a lot of other places seem to be missing. And I'm so glad that you were able to find that. I was also wondering, before you did find the Institute, what were some more of the specific health challenges or goals that you struggled with?
Perhaps the biggest issue was getting treatments that seemed to be working and then crashing because I would overdo stuff. That was a continuous problem. Some of that is pacing, which you just have to learn on your own. And I'm working with pacing now, even. It's a continual thing. The other thing was finding places and people who really understood what I had a problem. Like I was talking about pain clinics. Pain clinics could be very good for people who have had usually acute injuries, so pain from accidents and pain from injuries and such. And they would work real hard on building strength in the body and tapering down on your medicines and keeping an eye on activities. But they were still thinking in the mindset of someone who is otherwise healthy. So I went to a pain clinic for several weeks. They felt I did beautifully, and I survived the whole situation, and I did improve while I was there. But as soon as I left, I got worse. And it wasn't a matter of maintaining it. It was that actually the weeks there were too strenuous. I had reached my limit. I was at the edge the whole time I was there, doing as much as I could. And I was much younger then at the time too. So I was actually able to handle that even though I was sick, but it didn't help long term. They didn't understand the nature of a fatiguing disorder. They were mostly dealing with the fibromyalgia issues or just pain. It wasn't just not beneficial. It was actually detrimental. It set me back quite a bit after it. It's one of those where I read it to lots of very well-meaning people, but without the understanding that you get from Dr. Klimas and Dr. Ray, having dealt with lots of people over many, many years, and understanding that the biggest advance you can get right now is understanding how much you can do and not doing more than that, and working to make what you can do a bit more as you go along, which sounds like something that everybody does. And it kind of is. The nature of the sort of, you can do all this stuff and then crash. I haven't seen a lot of other illnesses that have it to such an extreme as chronic fatigue. My father had severe back injuries when I was younger, and he too would go through these periods where he felt he could do a bunch of stuff and he overdid it and was set back. But there was still ability to recover from that was better than anybody I've known with chronic fatigue or myself. And understanding important it is to try to avoid crashes, to really work with that is important in being able to make progress. Because if you just keep doing a bunch and crashing and doing a bunch and crashing, you're not going to make any improvement. And you might well set yourself back further than when you started.
Absolutely. And I think you made a really good point about you don't want to push yourself too far in crashing. And I think that the clinicians that we do have at the Institute, like Dr. Junko and Dr. Ray, they're very knowledgeable about keeping patients in their energy envelope and helping them understand what pacing is and how to integrate it into their current health situation. And it seems like that was really helpful for you. I really wanted to learn more about, I know you said, was it your mother who had a previous connection to Dr. Klimas?
So my mother has always been sort of a go-getter, and she's going to go research anything she finds, needs information on, big on that. And so when I first became ill, and it was clear that I did not just have a really bad chest cold that I was going to get better from, she started looking into what could be wrong and who to see. And she was able to find Dr. Klimas. And at that time, she was working with Dr. Major at the VA clinic. And she had looked up chronic fatigue, and she read about it. And she said, this sounds like what my daughter has. And because of that, I was able to see Dr. Klimas, Dr. Major at the time, within months of being ill. So I avoided the stories I've heard from so many other patients of going to doctor after doctor who there's nothing they can find wrong, or is there really anything wrong? Or, it's you're blowing it out of proportion, or it's in your head, like that somehow makes it less. That I was able to get in to see Dr. Major and Drs. Klimas and have that knowledge that, okay, I just needed to go see a bunch of other doctors at the time to make sure I didn't have anything else. And once everything else was ruled out, that's when I learned that there could be much worse things. Then they said, yes, you have chronic fatigue. And it was not long after that, I got diagnosed with the fibromyalgia as well. And it's actually one of the reasons I'm still trying to remember to do ME instead of chronic fatigue in my head. I want to switch over my years of practice with the different words. It saved me a lot of trouble in the beginning. And my mother has been very involved in advocacy for me for the illness altogether. She would go to conferences, go testify at one of the House committees in Washington, and engage in helping to raise money and create exposure for the disorder and make sure it's out there. So she's been very involved with my illness, with chronic fatigue in general. And she was also very important in trying to find all these other people who might be able to help. You know, people had tried pain clinics and some people have been helped by them. People had massage therapies. And so we'd try this place or that place. I started by going to one of the schools for massage and having students work on me and finding out that, yes, Swedish massage feels lovely. Did not do anything once I left, so that wasn't enough. And then we'd find a different massage therapist, some through Dr. Klimas, who did deep tissue massage and found that while it could be very painful, had long-lasting benefits, much like finding acupuncturists who were able to treat stuff. And when the Institute was opened up and Dr. Junko started doing acupuncture, we knew because of her connection to Dr. Klimas and Ray, and actually I've known her for years before, that she would have an understanding of what they were trying to fix, like what in the body was going wrong. And she could work on stuff that wasn't just symptoms of pain or stomach problems and such, and that she could actually work on energies and not crashing as badly, which has been one of the most amazing things with her is that, I have on occasion done a lot and it's been a bit too much. And I don't get the crashes like I used to. I'm still tired, still definitely did too much, but I am able to sleep it off the way people without chronic fatigue tend to sleep things off. I get very tired, but when I finally wake up and get up, it's not weeks of not being able to do stuff. It's a huge improvement in that. For me, it's very life-changing. I did manage to find other treatments before the acupuncture and stuff with medications, with pacing, with certain exercises, and using a CPAP, which when I first used it didn't seem to have any change at all. But I had a doctor who was like, you know what, keep using it. It's doing something even if you don't notice. And now I will not sleep without it because I can't tell you exactly what it is. But if I try to sleep without it, I can tell, and it's not good. So it's very helpful having people who have an understanding of the nature of the disorder, of the physical properties of it that we understand, and that there is differences in it, that as much as we're still an umbrella term, that there are people who have different forms, and being able to target my form and then being able to help other people with theirs. When I got ill, I was actually a physics major at the University of Miami, and I did try very hard to stick with it. And I took a few years off of education altogether until I was able to actually get out of bed to take classes. So I've always been very science-minded, results-oriented, and paying attention to data and paying attention to recording like how I feel and how I'm acting. And when I'm taking a medication, being very careful of, one medication at a time, make sure that the side effects I might have or the benefits and what it's actually doing. And so I've applied that same type of thinking to the acupuncture, to massage therapy, to vitamins and minerals. And some of them, if I don't personally see a difference, sometimes I base continuing it on the science. With my CPAP, I did not notice a difference using the CPAP, but my doctor, who specializes in neurology, said, you may not notice a symptom improvement, but your brain does benefit from being able to get that oxygen through the night. It was probably more than 6 months before I started realizing that I wasn't willing to nap without going and using the CPAP. And when I really thought about it, I was like, oh, I'm not sure what it is that is improved, but something has changed. Obviously, my doctor wasn't just right, but it just took a really long time for the benefits of my brain getting the oxygen through the night to show up in my behavior. And while I wouldn't say that I has slept better or woke up better, the fact that I didn't want to nap without my CPAP, it was doing something. And somewhere I was able to tell that because I really didn't want to not use it. And I've had similar things with other treatments where I may not have noticed an obvious change right away, but I stuck with it because there's some science evidence behind it, or because the person helping with the treatment said, sometimes it takes a while for your body to build up enough of the vitamins or minerals so that you've got all the amount that you need, right? You don't take a massive dose and suddenly have a massive dose. Your body keeps using it and it can slowly store away a little bit at a time. And so it takes quite a while for it to show up. Just like when doing any of the diets where you go off something, you can't go off milk or something for a week or two. You have to go off of it for at least 6 months. Let your body completely get rid of every bit of the evidence of milk in it before you might notice a difference. And I did doing that. And with some stuff, I definitely noticed a change. And with other stuff, I didn't. For the case with milk with me, I went off of it. I didn't notice much of a change. I went back on it. Didn't notice a change. So I drink milk. Other people I know, it has been significant improvement. So I have noticed personally a change that I can document from doing breathing exercises, from getting acupuncture, changing my diet. And I know from scientific studies that other people have had this evidence. And if you're not sure, treat it like a science experiment. Do your due diligence of keeping a record of stuff. And if at the end it doesn't work for you, it doesn't work for you. And you can stop it and safely say, hey, I tried it and it wasn't helpful and I'm going to go try something else.
I think that's great, and giving everyone the permission to listen to their bodies, but also to keep an open mind and not disregard a certain modality or diet recommendation if you don't see instantaneous results, because as you said, that's not how it works. And if you allow your body a chance to react, it might just help you. And like you said, if it doesn't, that's perfectly fine as well. So I love that you brought that up. I would really love to hear more about acupuncture, specifically how it worked for you, as well as additional modalities Dr. Junco incorporated? And also if you could touch on if you had any initial hesitations, fears, concerns about these modalities.
So with the acupuncture itself, the biggest thing people are generally concerned about is the pain of the needles. And two things about that. One, a lot of them you can barely even feel. But when you do feel, it's a needle, it's uncomfortable. Sometimes you hit, she puts them in a muscle that's really tight or something. And the muscle, I've had tight enough muscles that they'll kick the needle out,
Wow.
And that you feel, you really feel that. It calms down, and having the needle in there and helping to relax it, it does help afterwards. A lot of this is realizing that you might have some pain and increased discomfort at the time of treatment. And she's always clear about, before she leaves you there, are any needles uncomfortable? If they are, she'll take care of it. She doesn't want to leave you in pain. You might have some initial discomfort when the needles go in, or if she's putting electric stimulation through the needles. When she's adjusting it, sometimes it can be a little strong, but she turns it down. She's very careful about not leaving you in pain and everything. But you have to realize that these kind of treatments have a benefit later. With the deep tissue massage, like I was talking earlier, there was stuff my massage therapist would do that was really uncomfortable when he was doing it. But I learned that because he knew what he was doing, he was working, and he would explain to me too doing it, which is something I always appreciate. And Dr. Junco will explain stuff as well, putting needles and stuff. If you feel uncomfortable about someone just doing things to you, which, I often had a problem with, saying, a bit of why is that you're working on here, or what is the point of this? And she is willing to explain to a layman's extent. I mean, I'm sure there's much more complexity to it. That, the needles she's putting up in your head have to do with energy and flow. But, if she was putting them on my shoulder, she's often treating my shoulder. And having those explanations is very helpful. Knowing that the pain is temporary and having benefits later. The acupuncture is nowhere near as uncomfortable as massage therapy at all. And has the benefits later as well. I was fortunate enough to have found some acupuncturists before who were very good at treating specific problems I had. So intestinal pain or discomfort, pain in a knee or a shoulder that I had injured, and they were able to treat that. They wasn't able to see them enough, or they didn't have enough understanding to do the whole treatment, but it gave me that knowledge that this isn't hocus pocus. I may not understand the method, and it's definitely not a Western method. It's Asian. It's a different philosophy, but that they did a treatment and I had results from it, that it helped. And so going in with Dr. Junco, I knew that there was potential there. And I known other patients of hers that had gotten treatment. And so I knew there was potential, and I was hopeful that it would work for me, because I am also well aware that just because a bunch of other people have gotten better from something doesn't mean it's going to work for you. I know so many people who have so much problems with medications, and they'll take a medication and they're good for a few months, and then it stops working for them, or they become too sensitive to something. And I have been fortunate not to have that problem, but so many other people I know do. And I also talked to other people who've had treatments that worked for them, and I tried it and it didn't really work. The other things Jackie has worked with me on, or Dr. Hunko, is weight and exercise. So she had started having me track my meals, which I'd done at times before, and I've gone on plenty of diets. I've been pretty good about not following a lot of the crash diets, but I did all the gluten-free and lactose-free and avoiding corn and tomatoes, and I'd got allergy tested, avoided a bunch of those for a while, did the whole put it back on, avoided the gluten and the lactose and all of those, just to make sure that I wasn't having a reaction to them. So I'm pretty good about following diets, but having a tracker, having regular encouragement, keeping an eye on stuff, it's hard not to emphasize, or sorry, it's important to emphasize how wonderful it is to just have support in following a diet. And I'm sure anybody who's tried to do dieting, just having somebody else who's saying, checking in and going, how are you doing? Oh, not quite meeting your goals. It's baby steps. You work on it. Are you doing better at all? Oh, you had a day or two with a party. That's okay. You'll get back on it and you'll be able to keep going. And, having people notice when I started losing the weight and pointing it out. And it's the type of thing that if you have a good group of friends who are minded like that, that's lovely. But it was very helpful having that. And in addition to tracking my food intake, she started me on a fasting lifestyle. Now, that can sound very extreme, and it can be very extreme. What she was suggesting is not extreme. It is relatively simple to start with. It's intermittent fasting is the term that it goes by usually. And it's pretty much that you pick 13 hours of the day that you don't eat. And that includes when you're asleep. That already takes a chunk of hours where you're definitely not going to be eating. And you just make sure that on either end of it that you're not eating. And starting with that, sometimes you can work up the amount of hours you're fasting. We're very clear to be careful with making sure that the fasting isn't negatively impacting your health. Because that was what I was worried about. When I first started hearing about the fasting stuff, I was like, well, that sounds lovely, but can I do it without having, negative effects? But starting small and keeping an eye on stuff, it turned out that I was fine with it. And I've been able to fast longer. Sometimes it's been incidental. Sometimes it's been planned. Sometimes it's just a matter of being like, I've eaten dinner. I could have a snack before bed, but maybe I just won't, and then you have your fasting window. She's also introduced me to doing Qigong, which I'd known about before, but I hadn't incorporated regularly. And I'm actually still working on incorporating it regularly into doing a little bit more, keeping track of your steps, which used to sound kind of silly to me, but it does make sense, and just trying to do a few more than you had been, and trying to just slowly increase that over time. And I have been able to do that. I started out with something like 2,000 steps because I was like, I want a target I will hit no matter what. And, now I'm regularly getting in about 5,000. So, and trying to work up from that, trying to go on walks regularly. It doesn't have to be long walks. Sometimes it's 2 blocks at the most or less. I have the fortune of having my sister and nieces and nephews in here. So they keep me a little extra active. So that's been helpful on the activity side. She's also encouraged me to do the breathing exercises and meditation, which is one of those things with, just like a lot of people come to with acupuncture and stuff, feels a little hooky. It can. I've known the benefits of breathing since I was young. My mother felt she used breathing methods to help with the birth of all three of her kids. We should probably learn them for issues as well. So I've been using breathing methods for blood draws and shots and, injuries and stuff for years. But just doing it as part of meditation and relaxation and sort of centering. And something that I did not know about for years was that if you do that, the relaxation, the breathing, you trigger your parasympathetic nervous system, and that can help heal the body. Now, it's not something magic that not going to be ill anymore, but it does help keep you on an even keel at the very least, right? So when you do a little too much, making sure that you're doing those breathing exercises, that you're triggering the parasympathetic nervous system, can help keep you from really crashing. And as Dr. Klimas has explained it before, people with chronic fatigue, our nervous system is kind of revved up. It's kind of eager to go. And the parasympathetic doesn't trigger the way it might in somebody who isn't ill. And so intentionally triggering that can be really helpful in maintaining a normal body. And she's even suggested, doing massages and stuff to help trigger it with the vagus nerve and such. But the breathing and meditation helps with that. Advising on certain supplements and vitamins and minerals that I might want to try for certain issues, that she suggested various things that have been helpful.
I think that it's really important that you acknowledge that it's a progressive process, that it's not something that happens overnight. Also, specifically that different things work for different people. And it sounds like you were just so willing to keep your mind open and try to see what was going to work best with you and your current diagnosis. I was wondering, do you feel like there's a specific modality out of the ones that you mentioned that stick out above the rest, or do you feel that they work so well because they are in combination with one another?
So I have to say they do work best together. I found with everything over the years, it has been, this helps with that, but you also need to add something else and something else. The most beneficial life thing I've had over the years has been pacing. And that is something that Dr. Junko helps emphasize, that pacing is important. And as much as you want to push your boundary to get a little bit better, you need to be careful not to do it too much. If you do overpush it, now you've understand where that boundary is, step a little back. Each one does something different. So the fasting has been really beneficial with weight loss, which I wouldn't say I had a huge problem with weight, but it was that incremental every year. You just gain another half pound, and before you know it, you're significantly overweight. Is it a problem from a body image standpoint or anything like that? Yeah, I mean, I thought of it that way too. Mostly it's that I've had other doctors over the years, and from personal experience of my body, that you're heavier, you have joint problems, going to make the joint problems worse. If you have sleep apnea, which I do, it's going to make the sleep apnea worse. If you have cardiac problems, it's likely to make that worse. So it's one of those things where if I were healthy, I may not be as worried about the weight, but I also feel like I may not have had as big a weight problem. Who knows? But it's been very beneficial for the fasting and the calorie tracks for the weight. But I would say that the Qigong and the supplements and stuff with the acupuncture itself has been much more beneficial for energy level and having less of a crash, feeling better sooner. And it's hard to say that the diet and everything was probably helpful with that too. I'd have to say on the whole, it's that you need to integrate everything. I mean, integrative medicine has that name for a reason. It's because no one thing is a cure-all. And that is pretty much true for every problem, and every health issue generally has some level of mixing a bit of this and that to treat it. But stuff like chronic fatigue and fibromyalgia, it's just that much more. As much as it would be lovely to have a pill you could take and be better, and they are technically working on that. I found that, you find all the little bits that's wrong that there is medication for, and you do that. And if you can handle the medication, that's great. And you have to do your pacing and do the acupuncture or the massage therapy. Keeping the diet helps a lot with avoiding things that might make things worse, right? So after Dr. Ray had started learning all the environmental science and stuff like that, she came back and started, if you can avoid the plastic, it probably would help. And so started doing some of that. Do I have a direct knowledge that me avoiding plastic is really helping? No. Do I believe the science that it probably is? Yeah, I do. And I've always had environmental sensitivities. So I have issues with bleach and with paints and all of that stuff. So the idea that there might be chemicals in materials that I can't smell but are still affecting me, I've always had a firm belief in that, because the stuff I can smell can really knock me out. But I think, yes, keeping an open mind, understanding that the illness isn't simple, the treatment isn't going to be simple. And that if you can stick with stuff for a while, you are likely to see benefits. Now, should you continue doing it for years if it's not helping you? No, but I would definitely give several visits of acupuncture before making a final decision that it isn't helping you. Take a supplement for several months before you decide it isn't working. And be sure that if you are skeptical about whether or not a treatment is helping or could help, you really want to try your best to keep notes of how you're doing. And your memory can be terrible looking back at stuff. I've had times where it is only because I kept notes or somebody else was keeping notes that I realized I was doing better. And I think the biggest takeaway with this and a lot of other treatments is how you subjectively feel is not actually the biggest thing you should pay attention to. I have gone through a lot of clinical trials and a lot of treatments that I can tell you I did not feel better, but I did more. And that is an improvement. So just because I was still tired and still in pain, but I got out of bed and I started cooking when I hadn't cooked for 2 years before. This was a clinical trial with a bed. And I was so oblivious to it that I didn't particularly notice it. And my mom had to be like, it's been 2 years, you haven't cooked. And I was like, oh, I used to cook all the time. And then after I got ill, I didn't have the energy for it. But now I am cooking. And if you'd asked me how I felt, I did not feel better, but I did do more. And I've had the similar experiences on pain medications that didn't feel like they made the pain better. But again, I was doing more. And when I first started on the acupuncture and stuff, I wouldn't say that like the first treatment or two, or when I first started the diet, that I felt so significantly better. But I did notice an increase in being able to do things, not feeling refreshed when I woke up, but not feeling quite as exhausted. And feeling, even though I was tired and worn out, that I did still do that extra thing that somebody asked me to do. It's really important to notice those things where you are getting better, even if you aren't feeling better. And I know from previous trials, Dr. Klimas herself has mentioned they made the mistake of writing into a study where how someone felt was part of the baseline, and the drug did not pass because people didn't feel better. But they had evidence they'd improved, but it wasn't what they were basing the study on. So she's like, this drug, it helped a lot of people, but nobody subjectively felt better. And because that was the what they based their study on, is like whether or not you did better was how you felt better. And the reporting that it didn't pass its study. She's like, oh, now they know you can't just rely on feeling better. In the long term, when you're doing more, that does improve a mood and outlook. But you can still feel really tired and have a lot of pain and be improving.
I think that's really important for people to keep in mind, especially people with these chronic illnesses. You kind of become adjusted to this new norm, and probably those slight changes of being able to cook a meal or do something extra that day that you might have not done for the past few years with your diagnosis. It might be hard to recognize those things, but I think it's so important that you point that out and that people celebrate the little victories, because they're not so little. I think that's a huge thing for people. And just to give yourself grace, which it sounds like you do and you have done. To close everything out, I just would love to hear how you would describe your health today.
So when I first got ill, I was pretty bedridden. I was able to get up and go to the bathroom myself, and get up and go eat food. But I was asleep most of the time. My mom would talk about coming in to make sure I was breathing. So it was that level of exhaustion and tired. And it was very slow progress where I got to the point where I was able to mostly take care of myself with a great deal of help from my parents, with financial support from them, with getting on disability, so that what work I did do was really minimal, and the pay would not have been significantly helpful. And spending most of my time making sure that I took all my medicines or was able to take care of myself to a certain extent. And just taking care of myself was not only such a big job, it was pretty much the only job I had. I did a little work at a movie theater that I'd done before I got ill, or, a few other things for an hour or two a week. But whenever I filled out the survey, which I'm sure anybody who's had this, the how you functionality survey, forget the name of it, I was always in the not able to work, not really able to do household chores, just taking care of myself. And then I was able to get to the point where I was able to do some household work as well, where it was either, some household work or some work outside of the house. And I would say now, one of the biggest tells of how I'm doing is I have nieces and nephews in the house that I help take care of. And I not only do that, I feel I can do that. Now, that means that I am able to actually do household chores more than I did, cook, and not just for myself, but, randomly cooking for these kids, helping with homework and, all the sorts of things kids do. And I am not overwhelmed. Now, to make it very clear, I am not the sole caretaker of these kids. I am not saying I would be up to that level, but I can assure you that, years ago, I wouldn't even have been able to do this. And I feel that the ability I have now to help with the kids, to help keep the house and take care of myself, the ability to do all of that is very much part of involving the acupuncture, dealing with the diet, dealing with doing a little bit more exercise and a little bit more slowly, feeling well enough to keep track of all my medications and take them regularly and not fall into a loophole of I'm tired, I didn't take it, then I didn't take it, so I'm tired. And then, you're just kind of doomed until somebody comes and helps break you back out of it. And I think looking at things all together and looking at them slowly and working up has been really important. That I wouldn't at all say that I am cured or that I am well enough to go it alone, but I am doing so much better, that taking care of my own health, I am now assisting with my mother's health, paying her back for all the years that she was advocating and keeping track of my meds for me, and taking care of these kids. And I don't think that I would have been able to do it without the Institute helping me work things together and progress this far.
It's just such a wonderful thing to hear. And I'm just so glad that the Institute could be part of your health journey and that you feel like you're at a place where you probably didn't even imagine a few years ago, and that you're recognizing this isn't the end of these interventions or modalities, and there's always still more work to do, but I think that you are doing it so gracefully and you're able to explain everything to our community in a way that I know that they will empathize with, and I'm sure will help someone kind of knock down that barrier of being hesitant to advocate for their health and go out there and find the help that they need like you did. Before we go, is there anything that you feel like we didn't touch on? Anything, parting words you want to give to our community? Or do you feel that you had wrapped up everything the way that you wanted to?
The biggest thing with chronic fatigue in particular, but the fibromyalgia as well, and a lot of these new long COVID cases and such, is very easy to become stuck and depressed that there isn't a fix. But to be hopeful, there are very smart people out there working on it. And I try to get in every medical trial that I am qualified for, to try to help move that forward. And it has moved forward. As much as it feels like there isn't anything now, I can look back, and I know people who can look back even further, Dr. Klimas among them, that there has actually been improvements over the years. They haven't been radical, but they're new, and they've worked, and they've helped a lot of people. And There is hope that more is coming, and there is hope there's more that you can do yourself to help yourself.
Kristen, thank you so much for sharing your background and your story with us. And we just really appreciate you taking the time today.